Hi guys, I'm Dr. Rajat, and with me I have Dr. Darpan. She recently joined our Master Clinical Implants training, the Advanced Implants training. She's a maxillofacial surgeon, and she wanted to gain the prosthetic. She wanted to know the prosthetic aspects of implants and wanted to place more implants. So this was her third day, and you did place total 4 implants today.
Yes, I did.
And till now, how many implants? You've placed around 7 to 8 implants till now.
Yeah,
So
I
all
think
the
I've placed around 7
yeah.
implants.
So all the cases that you've done, how is your experience?
It's been absolutely wonderful. I have learned not only just the surgical placement of implants, but also the prosthetic component that follows later on, which is extremely important. And I think as a maxillofacial surgeon, even if you do focus on implants, the prosthetic component is definitely something that we don't usually get to focus on. So it's been fantastic. I'm very happy with my day today. I got to place 4 implants. It's been amazing.
You know, all the 4 implants were totally different.
Yeah.
You did little bit of immediate implants, bone augmentation. You did place mucograft yesterday. You did an anterior aesthetic implant case. We placed the bone grafting and then the approximation of flap. So do you really think that implantology is an emotion? And you really feel that it's like a complete movie where you need to have every step in a proper manner?
Yeah, definitely. I think it's something. It's basically a series of steps that you, if you're familiar with them, it's something that you know. It's a movie that plays in your mind.
So first day was a trailer, and you know we are working on every aspect of it.
Yeah.
Looking forward for you to practice more cases. Do a lot of hands-on and practice on the bone self. I think that grows on to you once you start doing implants. So having said that, having trained more than 500 maxillofacial surgeons, more than 1,000 clinicians, it is an absolutely pleasure working with them, and it's very overwhelming that out of their comfort zone they want to upgrade their skills in terms of getting better, in terms of giving their patients something different, and which is very, very precise and exquisite and precisional. At the same time, the technique that we use is totally different. Customization of not only the implant kit but also the technique that goes with. For example, जब हमने implant drill, जब हमने position किया था, we did an immediate implant case. There is a concept called DTR. So we use a lot of asset kits, osseodensification के साथ, how to manipulate, how to make it more simplified, ridge split कैसे करना है. Imagine you're placing an implant on the dense anterior zone, and placing an implant like a butter. So it is so easy. Yesterday was a case that we did, there was hardly any bone. The bony width was 2.5. We placed implant for 3.5. We got good torque. We engaged the nasal floor. So every time you have to evaluate the easier for you to manipulate, and at the same time, once you start working on the magnification, the surgery becomes easier. So the goal is to do your treatment, your patients getting better with the surgical pattern. So anything that you want to share or advice to the fellow clinicians who are watching this video, that why should they join the course and why should they learn about the implant dentistry? Yeah.
Well, firstly, as doctors, I think it's our duty to constantly make sure that we grow in knowledge and our clinical skills, and implants, even though they might seem simple, but there's a lot of technicality that goes into it, and that is it's always nice to learn from somebody who's been doing it and is willing to teach you and tell you their tips and tricks.
So I think मेरा कोशिश यही रहती है कि share everything that I think वो एक important factor है हमारी growth का. ऐसे cases हर रोज़ एक different cases, चाहे वो anterior implants हो, चाहे immediate implants हो, चाहे sinus lift हो, चाहे bone level implants हो, चाहे tissue level implants हो. It's an absolute pleasure to working with clinicians, and I hope we can continue for many years. Thanks a lot.